I am going to schedule a quick appointment. A quick appointment is used when you wish to place an appointment as you might have using the paper book. Note, the patient's name, along with other helpful information, is displayed on the title bar of the scheduler. I will click on the new appointment icon. In addition to verifying that you have the correct patient, a series of important reminders are displayed, including past due balance, insurance benefits, patient's medical alerts, number of missed, canceled, and broken appointments, recall status, and any other important information that is deemed essential during the appointing process. Click OK. Next, the reason for the appointment is determined. This is typically done by selecting one of the user-defined quick procedure buttons or using the treatment plan lookup to appoint a planned treatment phase. Essential appointment information is defaulted, but may be changed here. Click OK. The appointment is now ready to be placed. I double-click in the desired cell position. Of course, I could move to other days to manually determine the best placement. For tracking purposes, my system has been optionally set to require user identification. The appointment is saved.